textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kopsinger-Birchall, and in this series, we will take a closer look at disparities in healthcare, speaking with medical professionals, and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps. My name is Vivian Kopsinger-Birchall, and I'm excited to bring to you some highlights from the recently concluded Global Health Catalyst Summit that was held at the Sibley Memorial Hospital at Johns Hopkins earlier in July.
We have a common enemy today, and let's fight this common enemy by joining our forces together. And the chances are very good as this project is really having a success.
That's a short question about the Oncology Commission. Have you followed its formulation, and what are some of the best practices from it that you think can be applied to Europe and other parts of the world?
Yeah, one of the mission is, in fact, better trained professionals. That's very important. In some countries in the Balkan, for example, we have enough machines, let's say, or facilities to treat cancer, for diagnosis and for treatment, but still we are not so effective. That means we lack good training of nurses, professionals, oncologists, medical physicists. And one of the suggestions of the Commission, for example, is the importance of the medical physicists in the whole chain of treating the cancer illness, and that is what we are lacking also in our countries. The medical physicist is almost non-recognizable in these countries. In this region, for example, I'm coming from a city that we have a university clinical hospital, and there are no medical physicists at all employed in this hospital.
Wow.
So that was one of the recommendations that will really help also our region to pay attention in the future.
Right. Wow. Okay. Again, there are very key things that you're pointing out about. First of all, there's no medical physicist in a whole hospital.
Yeah.
That is alarming.
And we have CT, MRI, different radiation diagnosis tools, and we have no medical physicists, for example, because they don't recognize the importance of medical physicists in managing and in using of such facilities.
So is there anything else that we haven't talked about that you'd like our viewers to learn about this whole Global Health Catalyst program?
Yes, the message is really that we have to join forces together. We have to work together. The resources that we have be much better used and much effective if we are sharing with each other, being that material, being that intellectual, and the experience that different groups have. We have to come together and share this experience, learn from each other, so that we can better fight this cancer illness. Otherwise, it is very difficult.
Right, and in your experience and maybe observation, part of these collaborations require, high-end IT infrastructure for the collaborations to work. What has been your observation when it comes to the infrastructure needed for some of these?
Yes, that in some countries is very, very crucial, very important, and it needs a lot of investment in this direction. Therefore, we have to come together also with the politicians, with stakeholders, with decision makers in these countries. And that's what happens also in the summit. Therefore, we have ambassadors and ministers taking part in the summit, and that's important to speak with them, to come together with them and say, okay, we are together in one boat, so please let's work and solve this problem. But that's also one chain of the whole problem that we have in the cancer care. For example, in Macedonia, in North Macedonia, we have almost in every corner internet, so that's not the problem of high-speed internet, but the problem is in the other parts of all this infrastructure, as I said, in the training and more effectively using these facilities that we have and sharing also this knowledge and also these facilities with the others that lack these facilities.
Absolutely. Dr. Ziberi, it's always a pleasure to have a conversation with you.